pituitary gland is located in it's located in the middle of the skull, if we were to look at it like that, or you can say middle of the brain even, and it is a small tiny P-shaped gland. It's a very small gland which is encased by a bony cavity called the sella. The sella is like a cup which kind of covers the pituitary, it protects the pituitary gland, and it is located, as I told you, is just located just below the optic chiasm. That is, that the optic nerve goes from the eyes, it goes behind to the brain. So en route it goes over, it crosses and it goes over the pituitary gland. So basically that is where it's to put it very simply, it is situated inside the sella. It's called the sella turcica, which is situated just right under the base of the skull. It's the sella is basically a bony cavity. It's like a cup, and it protects the pituitary gland. The pituitary gland is one of the most important endocrine glands in our body. It's sometimes referred to as the master gland of the body, for this reason that it controls the functions of all the other glands. It controls these other glands by producing what is called trophic hormones. What we mean by trophic hormones is that these hormones secreted by the pituitary gland in turn goes and controls the secretion of other glands. For example, let's start with a hormone called the TSH, which is produced by the pituitary. TSH stands for the thyroid stimulating hormone. So what you have there is that the pituitary gland secretes this hormone called the TSH, and this TSH, or otherwise known as the thyroid stimulating hormone, will go and stimulate the thyroid gland, which is situated over the neck, to produce what is called thyroxine. So therefore the pituitary controls the secretion of thyroxine. So like that, the pituitary also produces hormones called the sex hormones, which stands or otherwise known as commonly known as the luteinizing hormone and the follicle stimulating hormone. So these hormones actually regulate glands such as the ovaries and the testicles in a case of a male. So again you can see how the pituitary influences the secretion or function of these glands, but also the pituitary secretes some hormones directly. For example, the growth hormone, which is responsible for the growth or the height attained by an individual is ascertained by the amount of growth hormone that the pituitary produces. It also produces a hormone called prolactin. Prolactin is basically a hormone that's responsible for the production of milk in lactating mothers. Also the posterior pituitary, or a part of the pituitary, produces hormones called the oxytocin and vasopressin, out of which vasopressin is more important because it is otherwise called an antidiuretic hormone. In other words, what the antidiuretic hormone does is it regulates the amount of water or urine that is formed. So as you can see, the pituitary plays a very critical role in the overall functionality of the endocrine glands as such, and no wonder it is called the master gland in the body. Going down to the disorders that we see commonly with disorders that affect the pituitary gland. Now the most common type of disorders is what we call a pituitary adenoma, or a small growth or a mass in the pituitary gland. And the most common pituitary tumor is basically what we call a non-functioning pituitary tumor. It's basically a tumor that we get to know because this tumor produces visual disturbance. So now the reason why there are visual disturbances is that the pituitary gland just sits behind the optic nerves, means the nerves which carry the visual impulses just go cross above the pituitary gland, and that crossing is called the optic chiasma. See, the pituitary gland just sits below that. So if there is a tumor rising from the pituitary, it compresses this optic chiasma, producing visual abnormalities. So we get to know this condition because the patient presents with visual abnormalities, and then when we investigate, we find a non-functioning pituitary. Now, this is not a rare thing. In other words, it's it's quite common, and we usually operate these tumors, and a lot of people can get this condition completely cured by the surgical procedure. The next commonest condition is what we call Cushing's disease. Cushing's disease again arises from a small tumor in the pituitary gland, and these patients present with obesity, means they have what is called central obesity, or they have a lot of fat accumulating around the tummy, and also they present with hypertension, diabetes, dyslipidemia, that is high cholesterol levels and all that. But classically what they have is what we call a central adiposity, or in simple words how we describe them is that we call them a lemon on stick sort of a figure, where the central where the central part looks like the lemon, and their limbs, that is their forearms and lower limbs, look like sticks. So they put on weight in the center, but they also have a mooning of the face. Their face becomes round, they have stretch marks on their tummy and all that. So it will be quite dramatic. The presentations will be fairly obvious to the treating endocrinologist that this is a case of Cushing's disease. Now again, the cure for this disease is an operation of the tumor, and how we operate the tumor is interesting. We go through the nose. It's called a transsphenoidal section or transsphenoidal resection. So we actually put a operating microscope through the nose, and we go in, we break open the sella which is in the skull, and then we approach the pituitary, and then we scoop out the pituitary tumor. So that's how people with Cushing's disease is treated. Then the next commonest disorder affecting the pituitary is what we call acromegaly. Acromegaly is a condition where these patients become gigantic, means they, their hands and legs start to become bigger and bigger. We call it spade-like hands, means hands become like spades. Also the feet can grow in size, so their footwear needs to be changed often. Now in addition to this, they present with headache, arthralgias, means joint pains. They also present with visual abnormalities like diplopia, etc. So these patients get sometimes picked up just by chance, because they walk into a doctor's room for another problem altogether, for example for a knee pain or a headache or some visual abnormalities, and the doctor suspects that they have acromegaly. Then we test these patients, and then we pick up the tumor. Again, the operation is the same, where we do a transsphenoidal section, go through the nose, scoop out the tumor, and a good percentage of these patients can get cured completely. Then the other disorder affecting the pituitary is what we call hypopituitarism, that is the deficiency of hormones. Earlier we spoke about excess of hormones, where we spoke about Cushing's disease, we spoke about acromegaly. Then these patients can also have an excess of prolactin. I said prolactin is secreted, is a hormone that's secreted by the pituitary gland. So if you have like a small tumor in the pituitary producing prolactin, then this condition is called prolactinoma. So in women, they present with galactorrhea. Galactorrhea is that there is milk production. These women kind of have breast milk which is secreted in even if they are non-lactating, means even if they haven't given birth or they've given birth a long time ago, but they still continue to lactate. So that's one of the presentations. Then these women can become amenorrheic, means they won't have periods. So these are some of the ways in which a prolactinoma or a tumor that produces more prolactin can manifest. It is more often diagnosed in women because of these symptoms like galactorrhea, but whereas in males it will be hard to detect a prolactinoma. So these disorders that I just listed out, these are basically an excess of the hormones, or the pituitary produces more hormones. Now there can be another subset of people with hypopituitarism, or where these hormones are in deficiency. Say for example, if growth hormone is deficient in mostly in children, they don't grow. In fact, they get dwarfed, and these children get picked up because they are extremely short. Parents notice that they are much shorter than their peers, so they bring it to our notice, and then we go about investigating, and we find that some of these children can have growth hormone deficiency. So then we certain children we can treat with growth hormone if that can benefit them, but sometimes even if growth hormone can benefit them, treatment gets elusive because it can be very expensive. So not many parents can afford this sort of treatment in children. So that is a growth hormone deficiency. Now you can have what is called cortisol deficiency, or we call it a central cause for adrenal insufficiency, or we call it secondary adrenal insufficiency. So what you have in these individuals is that they go into, they can become very weak. They can faint sometimes. Their sodium levels can go very low, and they can become drowsy. They have what is called salt craving. They like to eat more salt. They like to drink generally or eat things that are more salty, or drink fluids that contain more salt. It's called salt craving. Now the reason, or they can sometimes have diarrhea, and sometimes they can even become unconscious and lapse into a coma, and all this is because of the deficiency of this hormone called cortisol. And cortisol is one of the most important stress hormones. These hormones help us during the periods of stress. That is our basic reaction to let's say a situation, to a stress situation, is what we call as a flight or a fight. You either fight or you flight. So basically for these flight or fight, you need these stress hormones, the most important of which is cortisol. So when you have deficiency of cortisol, your body will not be able to mount a response against stress, whatever stressful situation it is. It can be a fever, it can be a stress that we are experiencing in our daily lives. Any one of these things, the body should usually cope by producing these counter-regulatory hormones or stress hormones. But when you have Addison's disease or secondary adrenal failure, cortisol hormone is deficient, so we can't deal with stress. So then they present with the symptoms that I just listed out earlier. And the treatment is by replacing steroids. We have corticosteroids, we have also mineralocorticoids. All these things we use depending on the situation in the dose that we think is appropriate. And usually the treatment is lifelong, and we need to monitor them periodically. This sort of summarizes the common disorders that we see in affecting the pituitary gland in our daily practice.